Hello guys, welcome to Math Chits. Here we have the case number 2. In the previous case we discussed, the case was all about somatotrophs adenoma, but here we have the case number 2. A 43-year-old man from Stockholm, Sweden has had a low volume watery diarrhea. So the patient is having the watery diarrhea for the past 3 months. He now has the mid epigastric pain. Over-the-counter antacids medication does not relieve the pain. Okay. On the physical examination, he is afebrile. On palpation, there is no abdominal tenderness and no mass. Okay, so here the tumor is not present in the abdominal area, or the pain in the abdominal area is also not present. And upper gastrointestinal endoscopy shows multiple 0.5 to 1 centimeter shallow, sharply demarcated ulceration is seen in the first and the second portion of the duodenum. Okay, so ulceration is usually the result of the high HCl secretion, which is usually performed by the gastrin. So usually this is seen in the stomach, but it is seen in the first and the second portion of the duodenum. So he's given the omeprazole as a treatment by the doctor, but later on after 3 months the endoscopy is repeated and the ulceration were still present. So it means the omeprazole here didn't work, or maybe having the low dose of the omeprazole. So which of the following analytics is most likely to be increased in his serum or plasma, and what is the diagnosis of this case? Okay, so here you can see the ulcerations, which is sharply demarcated and also shallow in characteristic, which is present in duodenum. It should be present in stomach, which is a normal, right? Because it's not a normal, but in stomach usually the secretion of the HCl is too much, so the ulceration may be present in the stomach, and it can be relieved by the antacids such as your omeprazole, rabeprazole and all. But here the patient is having the chronic, like for the past 3 months he is having watery diarrhea. So of course here you have given the 5 option. You can easily select that the gastrin is elevated, because gastrin is responsible for the secretion of the HCl, your hydrochloric acid. Now you have to diagnose the case. What is the diagnosis of this case? So here we discussed that the case is all about the increase in the gastrin level, which secretes your HCl. So too much HCl in your stomach, which leads to ulceration, and also we have to tell the diagnosis of this case. So the diagnosis of this case is Zollinger-Ellison syndrome, ZES. Okay, let's discuss the Zollinger-Ellison syndrome. So it's a gastrin producing secreting tumor. So usually the gastrin will be secreted in the form of tumor, and which is usually seen in the pancreas or in the duodenum, which is associated with the MEN type 1 syndrome. And the common signs and symptoms is recurring ulcer, as we seen that the ulcer is the main keyword here, right? The endoscopy revealed the ulcerations are still present after 3 months of the treatment. And thickening of the stomach and small intestine rugae. So we will also notice the thickening in the stomach and the small intestine rugae. Now there is a triad of Zollinger-Ellison syndrome, you can see here. So if you found the tumors in the pancreatic or duodenal cell containing gastric producing secreting tumor, or having the peptic ulcer for the long term, so it's multiple refractory to medical treatment. Ulceration usually present at the unusual sites such as duodenum, and also the gastric hypersecretion, which you know that too much HCl is producing, too much gastric is producing. So it has a stimulatory entropic effect on parietal cells that will secrete your HCl, and also your enterochroffin cells. And the treatment of this Zollinger-Ellison syndrome is usually to give the antacids such as your omeprazole, rabeprazole, pentaprazole for the long term. So that will act against HCl, and it will cure the your Zollinger-Ellison syndrome. Thank you.